Enteral nutrition, also known as tube feeding, is defined as nutrition, example, nutritional balanced liquefied food or formula, provided through the GI tract via tube, catheter, or stoma that delivers nutrients distal to the oral cavity. Enteral nutrition may be ordered for the patient who has a functioning GI tract but is unable to take any or enough oral nourishment, or when it is unsafe to do so. Right? So, indications for enteral nutrition may include persons with anorexia, or persons with orofacial fractures, hidden neck cancer, neurologic or psychiatric conditions that prevent oral intake, extensive burns or critical illness, especially if clients is in mechanical ventilation, and those who are receiving chemotherapy and or radiation therapy. As we have discussed kanina, na daanan natin, there are many types of enteral nutrition. So, we administer enteral nutrition through orogastric tube, nasogastric, and we have also a nasointestinal tube. Okay? So, usually the tube is a polyurethane or a silicone feeding tube that are long and small in diameter, soft and flexible, thereby decreasing the risk of mucosal damage from prolonged placement. So we use X-ray to determine the positions of the tube, and sometimes we aspirate gastric mucosa in patient to determine if the tube is patent, or we assist through the use of our septo syringe. We inflate the tube, okay, or introduce air to the tube, and by the use of our stethoscope, we assist for the placement of the tube. So if ever makarinig kayo ng gurgling sound sa stomach, so it is considered as patent. But in some cases, kung kinulang o kaya nagkamali ng insertion, sometimes you heard wheezing sound or whistling sounds. So sometimes the placement is in a wrong organ. So maybe in the esophagus only, or maybe nasa lungs yung tube ng patient. Okay, so you have to reinsert again the tube and assess for the placement and the patency of the tube. So tube feeding, we have a bigger or maybe a smaller diameter. Kaso nga lang, merong pagkakaiba pa rin, halimbawa, yung smaller diameter kind of tube is good for the standard decompression, nasogastric tube, while disadvantageous naman yung smaller diameter sa pagkakaroon ng bara ng pagkain. Okay? So when you are feeding clients, you use a bigger diameter nasogastric tube to prevent clogging of food. Okay? Although during feeding, nasogastric feeding, okay, so di ba, after checking of the placement of the tube, we position the clients in a semi-Fowler's position or almost upright position. Okay? Tapos you introduce liquid. Okay? Nagpa-flushing muna tayo before administering the enteral feeding. Okay? So after feeding, magpa-flushing na naman. Okay? So ganun yung ginagawa natin para maiwasan yung clogging. And then i-compress na ngayon yung sasarahan na ngayon yung tube after feeding. Okay? So hindi agad-agad natin binababa yung bed ng patient, okay? Para hindi magkaroon ng reflux ng pagkain. Parenteral nutrition refers to the administration of nutrients by route other than the gastrointestinal tract. Example, the bloodstream. It is used when the GI tract cannot be used for the ingestion, digestion, and absorption of essential nutrients. So, parenteral nutrition is a relatively safe and practical method of delivering complete nutritional support. We use regular IV solutions of 5% dextrose, okay, or D5 water, or sometimes we have D5LR or 5% dextrose in lactated ringer solution that contains no protein and have approximately 170 calories only per liter. Okay, while the average adult requires a minimum of 1,200 to 1,500 calories per day. So hindi nami-meet ng dextrose or the regular IV solutions yung pangangailangan na calorie ng pasyente. So we use other parenteral nutritions aside from intravenous fluids with dextrose solutions. Okay? So, for example, yung ibang pasyente natin is the patient sometimes sustains severe injury, or patients under previous surgery, okay? Or merong burns, and those who are malnourished, may have more or increased nutritional needs. Okay? So the volume of regular dextrose solutions needed to meet the caloric requirements. Okay? So hindi kakayanin. Ang tendency nito, kung gusto mong abutin yung pangangailangan ng pasyente na 1,500, you will increase the intravenous fluids, na sobrang dami na ngayon ng fluids. magkakaroon ng exceed capacity para sa cardiovascular system. So magkakaroon ng cardiac overload. Okay? Dahil sa sobrang dami ng fluid. So hindi kakayanin. So para ma-meet yung 1,200 to 1,500 calories na kailangan ng katawan, we use a commercially prepared parenteral nutrition-based solutions. Okay? So these based solutions contain dextrose and protein in the form of amino acids, and then electrolytes may be added, such as your sodium, potassium, chloride, calcium, magnesium, and phosphate, or sometimes vitamins and trace elements. Okay? So it is being customized to meet the patient's needs. Okay? So kadalasan nga, yung ginagamit is the so-called 3-in-1. Okay? So yung 3-in-1, it is a total parenteral nutrition, TPN. So pag narinig niyo yung TPN, total parenteral nutrition, it is an admixture, okay, containing an IV fat emulsion, a dextrose, and amino acid. Okay? Sa plastic nakalagay, okay, sa cellophane. Merong divisions ng tatlo. Pero meron akong nakita dati, yung tag 7,000. So 5 layer yung TPN mixture. Okay? So, magkakaiba yung calories niyan. And mapapanis yung parenteral nutrition sa loob lamang ng 24 oras. So, kailangan maiwasan yung pagkakaroon ng clogging sa intravenous line ng pasyente. Okay? So, always check for the intravenous line of the patient na kailangan tumutulo ng maayos yung total parenteral nutrition kasi sayang naman. Okay? Within 24 hours, mapapanis, i-discard na yung total parenteral nutrition. So, hindi mo na pwedeng ibigay sa patient. Okay? So, the calories in parenteral nutrition are usually supplied primarily by carbohydrates in the form of dextrose and by fat in the form of fat emulsion. Okay? So, ganun yung contents ng parenteral nutrition. Anorexia nervosa is characterized by a self-imposed weight loss. Sometimes it is caused by endocrine dysfunction and a distorted psychopathologic attitude toward weight and eating. Anorexia nervosa is a serious mental illness affecting 1.2% to 2.2% of people during their lifetime, and it occurs more frequently in women. Okay? So anorexia nervosa is clinically manifest as abnormal weight loss, deliberate self-starvation, intense fear of gaining weight, lanugo, merong lanugo, or the soft, downy, or covering the body, except the palms and the soles. Refusal to eat, continuous dieting, hair loss, sensitivity to cold, compulsive exercise, absent or irregular menstruation, dry and yellowish skin, and constipation. Signs of malnutrition are noted during the physical examination. So if you ever see picture, so ito yung saranggolang tao, butot balat, okay? While seeing herself in the mirror as obese, okay? So kailangan ng multidisciplinary treatment and must involve a combination of nutritional support and psychiatric care for clients with anorexia nervosa. Okay? However, improved nutrition is not a cure for anorexia nervosa. So kahit magbigay tayo ng total parenteral nutrition, enteral nutrition, okay, it is not a cure for anorexia nervosa. Bakit? Because of the underlying reasons kung bakit siya nagkakaroon ng anorexia nervosa. It is because of endocrine dysfunction. Halimbawa, kung endocrine dysfunction yung underlying cause, so kailangan i-correct natin yung endocrine dysfunction. Kung merong distorted psychopathological attitude toward eating and dieting, so kailangan i-correct yung psychopathologic attitude ng patient. So, ganun yung dapat magawa natin sa patient with anorexia nervosa. Psychiatric problems must be addressed by identification of the disturbed patterns of the individual and family interactions, followed by the individual and family counseling. In clients with bulimia nervosa naman, bulimia nervosa is a disorder characterized by frequent binge eating and self-induced vomiting associated with the loss of control related to eating and persistent concern with body image. Okay? So halos ganun din yung magiging picture ng pasyente, payat, pero yung tingin niya sa sarili niya, okay, is mataba. Kaya tendencies, pagkatapos kumain, sinusundot yung lalamunan para mag-induce ng vomiting. Okay? So, kakain ng madami pero magpapasuka. In some cases, kung meron tayong nakikitang mga tao na nagpapasuka, sometimes hindi naman talaga psychopathological yung nature kung bakit siya nagpapasuka. They just want to eat sometimes, baka tulad ng isang kaibigan ko. He really wants to eat. Okay? Madami. Tapos, after ng eating, pupunta ng CR, magpapasuka. But he knows the condition. Okay? Wala siyang bulimia nervosa. It is more of conscious, okay? Conscious induced vomiting sa kanya. Okay? So it's not really psychopathological in nature. Okay. So the cause of bulimia nervosa remains unclear but is thought to be similar to that of anorexia nervosa. So maybe secondary to substance abuse, anxiety, affective disorders, and personality disturbance. Okay. So over time, problems associated with bulimia become increasingly hard to deal with effectively. So a treatment combination of psychological counseling and diet therapy is also essential. Okay. So kailangan ng tulong.